Hi, everybody. I'm Jodi Frey, proud double alum of University of Maryland School of Social Work and proud to be your Dean for Research here. So this is my third year, and one of the benefits of being the ADR is that I really get to know our faculty and our research staff and our students even more in terms of the work they're doing. I get to promote their work, support their work, and really see it grow. So excited today to talk about some of our global research. Um, Not all of you might know that our work is not only multidisciplinary and uses lots of diverse research methods, but also goes beyond Maryland and beyond our country. And we're going to learn about how do we bring and use our social work values in the scholarship all around the world. How do we build community and work with our partners to co-design and co-direct and co-create in many, many different types of settings? So when I was asked to think about who we could maybe do an interview this year, I immediately thought of Dr. Lynn Michalopoulos, who is an associate professor here at the School of Social Work, who joined our faculty in 2022 and is the director of our global initiatives and also one of my fellow PhD alum. So you're going to learn about her work today. Her research focuses on the lives of migrant populations in Zambia, South Africa, Malawi, and Zimbabwe. She looks at mental health outcomes and the adaptation of evidence-based health and mental health programs among trauma-affected populations in non-Western context. And in all of this, she fully embeds our social work values and the importance of community engagement. I'll just say we're lucky to have her because she's leaving Friday morning for Zimbabwe. So for Zambia, yeah. So I can't keep track of where you're going all around the world. So I'm so excited that you joined us here today, Lynn. Could you talk to us a little bit to introduce some of your research and some of the connections with the communities in which you partner?
The first area of my research really looks at how do we measure and assess post-traumatic stress symptoms in non-Western context. Thinking about the development of post-traumatic stress disorder was among Vietnam vets, and can we really apply that to women that have experienced sexual assault in DRC? So that is one area that I've been looking at. I'm actually really excited to be got a revise and resubmit of a paper looking at the development of a scale that we implemented in Uganda among caregivers of children living with HIV. My second area of research is among labor migrants specifically, and more specifically, primarily most of my work has been done in Zambia. So really trying to understand the relationship between trauma exposure, mental health problems, substance use, and HIV risk, specifically among fisher folk in Zambia who engage in a lot of transactional sex, as well as long distance truckers who also are at higher risk for HIV. And the third area builds off of both of those in terms of development and adaptation of evidence-based interventions among those populations. And I'd say that really the communities that I work with are key to the work that I do. And, you know, going back to Zambia, I've been working in Zambia since 2012 and have built relationships with folks that are fisher folk, as well as ministry officials, university professors, and feel very grateful for those relationships that I've built and been able to maintain.
It's amazing the work that you're able to accomplish across so many miles. Since I've been here, I think I'm going on my 20th year now. So I know I started when I was a baby. I received a lot of mentoring and training. And so I do try to bring that to our school in my role as ADR. Some of you might get the research newsletter. So we were really excited this past year to hire Prism Schilling, who's working 50% in our research office and has already just done so much to revamp our communications, helping researchers identify grants, training opportunities, and we actually get requests outside of our school. I don't know if we get them in Zambia yet, but maybe for the different types of material that we share regularly. So tell us, as a growing scholar here, you were here as a PhD student. We're so glad that you're back now as a faculty and a leader for our global initiatives and research. What is the the type of support that you've received to help you grow your scholarship? And, thinking about some of the students in our audience, like what's been really helpful to you to learn how to do this work and to do it so well?
Thank you. Well, you're one of those supports in terms of, so other faculty within the school have been really supportive and been mentors and peer supports as well. I'd say not only faculty and staff within the School of Social Work, but I've been very fortunate to meet a number of really great and very, very supportive, but also very brilliant folks from School of Medicine, School of Pharmacy that also do work in Zambia. So that's been great in terms of kind of moving my work along. I'd say financial supports have been great within the School of Social Work, as well as from the Center of Global Engagement. And other internal awards, other smaller awards like through the School of Medicine, through the also the Health and Equity, Population Health. Those financial supports have been really key to my research. So financially, peer support, faculty support, students also is very important in terms of helping my work move along further. I'm actually going to Zambia with 2 students, which I'm really excited about. And I would say also the most important part of being able to move my work forward has been the populations that I work with. One of the women that I've worked with, one of the fisher folk that I worked with that engages in transactional sex for her livelihood, the last time I was there, we piloted a program that she went through, and she told me that she's now able to engage in other work. She opened up a hair salon 75% of the time and only engages in transactional sex for about 25% of the time. So I think that that's moving in the right direction. In addition, we developed a mobile application for long distance truck drivers in Zambia and went to a dissemination meeting. And one of the truck drivers said, I really wish that this mobile app existed previously because it could have saved lives. And so, that hearing that like drives my work forward. It enables me to submit that NIH grant that I didn't get funded yet one more time because then I have the motivation.
It's amazing, and I'm so glad that our school and the university and the communities that you work with have invested in this critically important life-saving work that you do. Now, you mentioned grants, so I have to mention grants as the ADR. So in academic year 2024, we submitted 114 successful proposals, and our research received almost $31 million in grants and contracts, a 5% increase from the year prior. So congratulations to everybody who is here and part of that. So Lynn, I'm wondering if you can talk about one of your projects a little bit more in depth so that we can really understand what do those research dollars go for and some of the impact and the collaborations that you're making. So take your time and we'd love to hear about a project of your selection.
Sure. Thank you. So one of the things that I have been thinking about, because it's the reason I'm going to Zambia on Friday, I was very fortunate to get the President's Global Initiative Fund through the Center of Global Engagement, which is a 3-year grant. And I'm working with Nicole Maddox, who many of you know that used to be research faculty here. She's very, has an expertise in climate change. I'm the more mental health person. So what we're doing is looking at the relationship between climate change and mental health, specifically among migrant populations in Zambia. So we're working with sex workers, long distance truckers, fisher folk, as well as cross-border traders. So this grant, I'm super excited about it because it is a 3-year grant. The first year, we worked with students to conduct a scoping review to kind of look at what does the literature say, what's out there, where are the gaps, and then we're going to present that to a community advisory board, so key stakeholders within Zambia. That's kind of the main purpose of our trip. We invited folks from each of those populations, as well as ministry folks, people from the International Organization for Migration, other NGOs that I have partnerships with. So I'm very excited about that. Once we develop that community advisory board, get feedback from them, we're going to do a needs assessment through a qualitative study with each of those 4 groups. And then take that information, and what we hope to do is to develop a community-based intervention in partnership with each of those populations. I'm really excited specifically for this grant, because oftentimes when you get internal grants, you can kind of do the first step. This grant really allows us to kind of do a number of different steps, all the way from the looking at the literature to the implementation of an intervention to kind of see like, how does this work? What needs to change? So we'll have a lot of data that we can then use for next steps. So I'm very grateful that we got that grant, and very grateful for the partnership that we have with the Center for Global Engagement.
It sounds amazing. I can't wait to see how it unfolds in this incredible project that you're leading. I just want to say thank you for being here and sharing just a snippet of the work that you do globally. So much to save lives, to improve the quality of life in so many global communities. Your research completely engages with the community and embraces social work values, working with our researchers, our students, our prior alum and staff as well. So thank you for being and continuing to be a role model for all of us here at the School of Social Work. And we wish you the best on your trip and look forward to seeing what will come next in your research.
Thank you.
Yeah.